Good afternoon and welcome to the fourth of the History Reflected Behind Closed Doors online curated talks. And a special welcome to our Sydney Living Museum's friends, members and supporters. This talk is titled How a Key from the Rookwood Asylum Came to Be in the State Archives. My name is Dr. Penny Stannard and I am the Head of Curatorial at Sydney Living Museums and New South Wales State Archives. I'd like to acknowledge the traditional custodians of the land where I'm broadcasting from today, at home, the Gadigal people of the Eora Nation, and I pay my respects to elders past, present and emerging, and to all First Nations people who are zooming in today. History Reflected is a new exhibition produced especially for the Museum of Sydney to mark the partnership between New South Wales State Archives and Sydney Living Museums, two of Australia's most significant cultural holdings. History Reflected presents a selection of 25 items from the New South Wales State Archives collection. They're some of the most iconic, beloved, treasured and curious items from a collection that spans over 14 million items. History Reflected presents these items across a time period of 213 years, from 1787 to the year 2000. And alongside each item is a reflection on what its meaning might be through the lens of today. These have been produced by artists, curators, writers, and a number of other creatives. As the Museum of Sydney is closed due to the New South Wales COVID-19 lockdown situation, we can't meet with you yet to enjoy the exhibition in person. So we've created this series of online curator talks to spark your curiosity, answer your questions, and connect directly with you until we can meet you at the Museum of Sydney. Each Thursday at 4 p.m, zoom in on this channel and hear from different curators who have worked on the History Reflected exhibition. You can write a question or make a comment anytime throughout the talk using the chat function in Zoom. At the end, there'll be time for me to answer your questions. And today, Wendy Gallagher, an archivist from New South Wales State Archives, will also join in the chat to assist in responding to your questions. Previously, in the Behind Closed Doors Curator Talk series, you heard about the 1828 census, a record that deals with our population from 193 years ago. You then learned about the story of Joseph Milsom, an ordinary man who established a life for himself in the colony of New South Wales. Have you ever found an old-fashioned key hiding inside a box, a drawer or a filing cabinet, perhaps left under a wardrobe, or covered in cobwebs in a long-forgotten corner of a dusty attic, or inside a box of precious letters or photographs? I have on a couple of occasions, and as I've picked up the key and inspected it, my imagination has fired up. Who did the key belong to? What does it unlock? What stories does it hold? And importantly, where can I try it out? I'm going to share my screen with you in a moment, so bear with me for just one moment while I do that. Today, I'm going to explore one of the most curious items in the State Archives collection, a large key from 1887. I included it in the History Reflected exhibition, not only because of the stories it can illuminate, but I wanted to show that while archives are often paper-based documents, they also come in many different formats. It's not that often that we find physical objects in the State Archives collection, so this key is unusual. It belonged to the Rookwood Asylum for Aged and Infirm Men, and it has survived in the Colonial Secretary's letters received. The key was sent to the Colonial Secretary by the Department of Public Works, following completion of work that was at the once called Rookwood Reformatory Site. All other keys remained on site with the buildings. One of the functions of the New South Wales Government over time has been to provide care for the poor and infirm as part of social and community services. Before 1862, this care was primarily provided by non-government organisations. The Benevolent Society opened the first asylum for the poor, blind, aged and infirm in 1821 on the site of Central Railway Station in Sydney. The word asylum was also used in the naming of institutions established to house and treat people who suffered from mental illnesses and developmental disabilities. Back then, the term lunatic asylum was in place, a term which has long been relegated to the past. In 1862, a Parliamentary Select Committee report found that the Benevolent Society's institutions were seriously overcrowded and the provision of care inadequate. In response to the report, the government assumed responsibility for the Benevolent Society's asylums for the infirm and destitute. The Government Asylums for the Infirm and Destitute branch was established in 1862 under the control of the Colonial Secretary's Department. The branch administered asylums at Liverpool, Hyde Park Barracks and Parramatta. These were designed to house and care for the most vulnerable members of the community. Between 1885 and 1892, a boys' reformatory was built at Rookwood. This was an era of government and societal agendas that advanced the institutionalisation of boys who were deemed criminal and in need of reforming due to misdemeanours, poverty, neglect, or absent parents. This image is a detail from a photograph taken inside a boys' reformatory in the early 1890s. The nautical school ship, Sovereign, operated as a training ship to reform wayward and destitute boys by providing them with education and maritime skills. It held 200 boys at a time, many of them aged under 10. I find the youth and vulnerability of the boys in this image extremely affecting. Rookwood Boys Reformatory was to be a model establishment with an agricultural rather than maritime base to aid in reform and be a sufficient distance from Sydney to encourage absconding. Now, as many of you would know, Rookwood is about 30 kilometres west of the centre of Sydney. But the 1890s became a time of economic crisis in New South Wales. As a result of this depression, between 1890 and 1895, the number of infirm and destitute poor housed in institutions grew by 40%. Government asylums were badly overcrowded and new solutions were desperately needed. In response to this need, the buildings intended for the boys' reformatory at Rookwood were rescheduled to provide shelter for infirm and destitute men. The cost and construction of the Rookwood buildings became the subject of an inquiry brought about by a change in government. The inquiry's report criticised the spending on the project, and especially the superintendent's residence. A two-storey house completed in 1887, and you can see that in the left-hand side of this image. A decision was made to redesign the site with additional structures to meet its new purpose as an asylum for aged and infirm men. The central principle of the revised design was health and modern sanitation. The pavilion system, as it was called, was used. This was a method of design promoted by hospital reformers, the most famous of which was Florence Nightingale, which came in the wake of the Crimean War and the conditions of its appalling military hospitals. According to historian Anthony King, mid-Victorian architects designed hospitals to conform with a basic plan, a series of separate pavilions placed parallel to one another and widely separated by lawns or gardens. And we can see that in this image here with the green grassy area there. Inside the wards, cross ventilation was achieved by placing opposite rows of tall, narrow windows reaching from floor to ceiling. The emphasis was on space and natural ventilation. This image of Rookwood Asylum's surgical ward clearly shows the windows open, letting air and light inside. And if you look carefully, you can see some of the men sitting up or lying down in their beds. Anthony King notes that although the pavilion system became popular in the United Kingdom, it was an expensive enterprise. We see a similar situation playing out in New South Wales, as health reformers and architects adopted the pavilion approach for Rookwood, which was then scrutinised because of the cost. At Rookwood, the asylum men were provided with accommodation and healthcare. This encompassed nutrition, respiratory issues, podiatry, tuberculosis, and sight and dental care. Poorly understood, mental health was not a specific concern for the asylum's medical corps, as it is today with health workers. In 1893, around the time this photo was taken, there were 202 residents in the Rookwood Asylum for Aged and Infirm Men. In 1926, there were 1,411 residents, 7 times as many as when it first opened in 1893. Over the preceding years, a full spectrum of medical services and departments evolved at Rookwood, and the word hospital had been added to its name. Interestingly, in 1919, the facility was the largest of its kind anywhere in the Commonwealth. In 1927, another name change followed, and Lidcombe State Hospital and Home signalled a new era in which the words asylum and Rookwood were relegated to the past, the latter to disassociate the hospital from the adjacent Rookwood Cemetery. During the scarlet fever and diphtheria epidemics of the late 1930s, a time in which my own father, then an infant, contracted diphtheria and was hospitalised and isolated from his parents for many months, the Infectious Diseases Division of the Lidcombe Hospital admitted male and female patients from the general public for treatment. This moment, driven by the need to respond to a public health crisis, signalled a shift away from the men's-only service. Gradually, Lidcombe evolved into a modern hospital. Its facilities were open to residents in the local area, and female patients began to be routinely admitted. In 1976, Lidcombe Hospital became a teaching hospital for the University of Sydney Medical School. Some of you would be familiar with the University of Sydney's Lidcombe campus. Perhaps you studied there, or know someone whose career as a sports scientist, medico, physio, or other allied health professional started with an education at Lidcombe. On the 1st of October 1989, Lidcombe Hospital was formally incorporated into the New South Wales public hospital system, and the last ward, the Jack Lang ward, closed in 1997. So we've heard about the history of the Rookwood Asylum for the Aged and Infirm Men as an institution. But what about the thousands of individual men who spent time there? One was Pierre McDoone, also known as Arthur Goon. Pierre McDoone was born in New Caledonia, or India, or Queensland, in around 1872. The records vary greatly. He was convicted of multiple horse stealing offences between 1887 and 1913 and was photographed on at least 6 occasions at Darlinghurst and Parramatta jails. You can see the photos from his jail records here. They're like a visual biography of McDoone told over nearly 2 decades. And if you read those smaller images from the top left-hand corner across left to right, and then left to right again, you'll see McDoone as he ages from a young man into middle age and elderly age. In 1887, the then teenage McDoone, an only child whose mother had died and whose father laboured offshore on ships, was convicted of stealing a horse and sentenced to 2 years on the nautical school ship and boys' reformatory Vernon, the precursor of the Sovereign, which we heard about earlier. Authorities decided that he would be an uphill battle to reform, and this comment remains clearly written on his record today. Over the next 26 years, McDoone variously worked with or thieved horses in Sydney and elsewhere in New South Wales. He served sentences at Inverell, Parramatta, Darlinghurst and Bathurst jails and was released for the last time in mid-July 1915. Arthur Goon, as the admission records state, was admitted to Rookwood Asylum on the 21st of July 1915 and died there 6 months later. These images of Pierre McDoone are from the New South Wales State Archives collection of jail photographic description books, an incredible resource that is available to you online. If you would like to research the story of someone who was admitted to the Rookwood Asylum for Aged and Infirm Men, or into other asylums such as the one pictured here at Liverpool, which were operated by the New South Wales government in the 19th and early 20th centuries, the Infirm and Destitute Asylums Guide, which is on the New South Wales State Archives website, is a good starting point. Asylum records in the State Archives collection include registers of admissions and discharges and admission cards, some of which have the patient's medical treatment recorded on the reverse side of all their personal information. Under public access directions, asylum records are open to the public after 110 years. In researching the story of the Rookwood Asylum for Aged and Infirm Men, people like me engage not only with the story of an institution, but with the lives of individuals like Pierre McDoone. This is what I love about the archives. One single item. A key, for example, can be the starting point for so many different stories and the wrapping and unwrapping of layers of history. While it's not exactly clear which door the Rookwood Asylum for Aged and Infirm Men, the key unlocked, what is clear is that it opens up history from so many perspectives. Stories from the archives can also open up a space for us to consider our lives today. For instance, when we hear about men in need of asylum, what first comes to mind? When people are homeless and without means, how do our decision makers respond? How does our community care for some of its most vulnerable? Right at this moment, in the grip of a public health pandemic, what can we learn from the healthcare practices of the past? These sorts of questions are explored in contemporary reflections on 25 items from the New South Wales State Archives collection, presented in the History Reflected exhibition. You'd be surprised what you can find in the archives. I certainly have been. From treasured troves of colonial era records to fascinating first-hand accounts of lives well lived and those not so well lived, to odd and quirky collectibles. The archives has it all. I hope you have enjoyed my talk this afternoon, and I'm now going to take questions assisted by Wendy Gallagher from New South Wales State Archives. There's so many questions on the chat. Let me start. Okay, what records are available for tracing individual inmates of Rookwood Asylum? And Wendy's provided a fabulous response here, noting that quite a few records have survived from Rookwood and are held at New South Wales State Archives. And Wendy has provided a link for you in the chat. As mentioned, records of individuals are closed for 100 years. You can request to access records within that period. And again, Wendy has kindly provided a link for you to click onto to find out how to do that. There's an index to people in asylums, including some of the people who were at Rookwood, and another link has been kindly provided. A comment, the 100 years is extremely frustrating for family historians. I will be a very old lady before I can get my great uncle's records. I have even written to the Minister with no joy. Surely it can be reduced. Pauline, if you are able to click on the link that Wendy provided in relation to how to access records within the closed period, that will assist you in negotiating that path. A question, what happened to aged and infirm women? There were also institutions for aged and infirm women. There were institutions at places like Liverpool, Parramatta. There was an institution or an asylum for couples at Parramatta as well. Do we know the main architects who designed the Rookwood Asylum? Yes, there were a number of architects involved in the design of buildings at the asylum over a number of years. There were the colonial or government architects, James Barnett and Walter Liberty Vernon. And also more recently in the 20th century, there was Ken Woolley, who designed the recreation hall there. I should note that the site of the old Rookwood Asylum is really significant because through its architectural design, it shows over a period of 100 years the changing attitudes towards the treatment of people in the public health system. And through its architecture, we can learn a lot about how people were treated and the sort of attitudes around that and how they manifest in the design of the facilities. Another question, how many of the original Rookwood buildings survive? So the site itself has sort of the footprint of the site over the years has contracted and expanded, and it has been used for a number of purposes. Some of the buildings do survive and exist as a site that was developed in the 2000s for private accommodation, private housing, so apartments, essentially. But interestingly, the site was also used during the Sydney Olympics. From 1998 to the year 2000, the Lidcombe Hospital site housed over 5,000 journalists from around the world. So that was where the media were accommodated during the Sydney Olympics. A comment from Kerry to say that 2 of her ancestors died at the Rookwood Asylum. Another question, what door did the key open? We're not 100% sure. It possibly opened the door to the superintendent's house. It does appear in reports and paperwork dealing with public works. So whether or not it was the key to a door or a building that was removed by public works or represents some kind of change in the buildings there, we're not 100% sure. So that's certainly something that we're looking into as closely as we can. Question, does your father's experience inspire you to look into places like Rookwood? So that relates to a comment I made that during the epidemics in the 1930s, particularly diphtheria, caused the Rookwood Asylum to shift towards providing healthcare to more than men to accommodate the scores, hundreds of infants that needed hospitalisation because of diphtheria. My father wasn't placed into that particular hospital, but he was placed into another public health hospital in regional New South Wales. And certainly what has inspired me is to really learn more about that era, the 1930s, and those terrible diseases that children suffered from. So definitely that has inspired me. So thank you for your question from Ingeborg. Okay, a question from Gay, and this will be one, Wendy, that I need your help with. People with intellectual disabilities were retained in Lidcombe. The records maintained through New South Wales Health seem very poor. Why is this? So we'll try and answer this in the chat. If not, then Gay, we will definitely come back to you through probably our Facebook social media platform. How can I keep these links? So that question has come from from Linda. Linda, if you can highlight the links in the chat and then copy and paste them into your search engine such as Google, click on those. What we might also do is after the talk today on both the New South Wales State Archives Facebook page and the Sydney Living Museum's Facebook page, we'll publish those links again, so they'll be there for you to access. A question from Linda, is Rookwood Cemetery on the site you have been talking about? Rookwood Cemetery is adjacent to the site that I've been talking about. So Wendy's responded to the question about records, about health records in New South Wales, noting that many records have survived. Generally, they are summary records rather than detailed files, particularly for these sorts of asylums. So that question has come from Bronwyn. So that question has come from Linda, if you can highlight the links in the chat and then copy and paste them into your search engine such as Google, click on those. What we might also do is after the talk today on both the New South Wales State Archives Facebook page and the Sydney Living Museum's Facebook page, we'll publish those links again, so they'll be there for you to access. A question from Linda, is Rookwood Cemetery on the site you have been talking about? Rookwood Cemetery is adjacent to the site that I've been talking about. So Wendy's responded to the question about records, about health records in New South Wales, noting that many records have survived. Generally, they are summary records rather than detailed files, particularly for these sorts of asylums. Another question from Bronwyn: was the superintendent's house purely residential, or did it also have an administrative function? My understanding is that it did have an administrative function as well as residential. It's a very beautiful house. If you can, at some point in the future, get out to the site, you will see that many of the buildings remain, and that is one of the buildings that remains. It's in private ownership for now, or under private tenancy, and it remains very recognisable from what you saw in those historic photographs that I showed you earlier. Okay, a message from Chris, a question from Chris. Wendy, this will be one I need your help with as well. Would information about staff at Rookwood Asylum be available in places other than the Colonial Secretary's paper and the Government Gazette? I'm excited that Matron Keel may have used this key. So again, we'll try and answer that through the chat. If not, we'll post on our Facebook pages. A question from Michael, I think. Outside of lockdown, how much of this site is publicly accessible? So my understanding is that there are areas that are deemed parklands that are still publicly accessible, and certainly you can walk the streetscapes and see all the exteriors of those beautiful heritage buildings. We've probably got time for one more question, if anyone would like to post. Otherwise, I have a few more words to say. Another question: if this lockdown lasts for much longer, would it be possible to show us around the exhibition? We have a lot of great digital programming happening around the exhibition, and we're working through how we can present as much of the exhibition to you online as possible. So please just stay tuned to our social media in particular to get the updates on that, including how we can replicate as much of the exhibition and the items displayed in it as possible to give you as much of an experience that we can while the lockdown's on. Thanks very much, Wendy. Wendy's responded to the question around how to access staff records for the asylums. So thanks very much, Wendy, for your great assistance today. Well, everyone, our time this afternoon is almost over. I'd especially like to thank Wendy Gallagher, who's helped us out with the chat, my colleagues Emily, Hannah and Scott Hill for their assistance in preparing this talk. And I'd like to thank you, our audience, for joining us today. I look forward to seeing you next Thursday at 4 p.m. when curator Anna Cosso will explore a series of extraordinary photographic images documenting the clearing of inner Sydney during the outbreak of the bubonic plague in 1900. If you're enjoying these history reflected behind closed doors talks, you may also enjoy our regular Tuesday curator talks. They happen each lunchtime on Tuesday via Zoom. For more information and to see what's coming up, go to the Sydney Living Museum's website, www.slm.com.au. Thanks again for tuning in this afternoon, and good afternoon.